Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions for hospitals and intensive care units to save money and resources whilst we are providing quality care. In last week's blog I shared Intensive Care at Home, how to do more with less. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to answer a question that we constantly get from people. And the question is, what do ventilated adults and children with tracheostomies need for in-home care? When looking after and caring for long-term ventilated adults and children with tracheostomies at home, a lot of people ask and want to know what actually needs to be done in order to make it happen. Besides a team of committed and highly skilled team of critical care nurses, we also need to look at the equipment side of things, and we need to organize ventilators, humidifiers, tracheostomies, ampu bags, suction equipment, special care beds and a hoist. Most of our patients or clients requiring our service are bedbound and fully or partially immobile. Those are the basics, and sure, there are other things we need to organize as well, but I won't get lost in the details. I'm sure you get the idea. It's basically like setting up a mini ICU in somebody's home. But what's most important besides the equipment side of things when providing in-home intensive care nursing services is the flexibility and the can-do attitude of staff to make this happen for our clients and their families, as well as helping intensive care units to free up their expensive and in-demand beds. It's a matter of being methodical as well as efficient when looking after long-term ventilated adults and children with tracheostomies in their own home. And it's really a matter of getting long-term ventilated adults and children with tracheostomies out of intensive care and improving their quality of life for them and their families. Intensive care at home is really all about providing a genuine alternative to an indefinite long-term stay in intensive care for long-term ventilated adults and children with tracheostomies. It's not that difficult to make the transition to home once you have seen how it works, and it's really a matter of having the right mindset, the right skills, the right equipment, and most importantly, the right attitude. The upsides are huge, with our clients and their families improving their quality of life in their own environment rather than staying in intensive care long-term or indefinite. A lot more is possible for some intensive care patients at home than what you think, and it's way more cost effective compared to an expensive and in-demand $5,000 per pet day in intensive care. In order to make our service safe, we have structured our service around the home mechanical ventilation guidelines, which makes it safe to look after long-term ventilated adults and children with tracheostomies in their own home. You can check out the guidelines on our website if you're clicking on the link below this video to the mechanical home ventilation guidelines. These are the latest up-to-date guidelines when it comes to providing intensive home care nursing services. Those guidelines have stood the test of time with our services, and those guidelines are the key driver for similar services in Germany. I want to know, what are your thoughts? What are you curious about when it comes to looking after long-term ventilated adults and children with tracheostomies in the home? Leave your questions and comments on the blog. For more information you can contact me on 041 094 2230 or email me at patrick@intensivecareathome.com.au. That's Patrick, just with a K at the end. We're also currently hiring enthusiastic and experienced intensive care nurses with critical care certificate for ventilated clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience as we have opportunities here as well. Check out our career sections for more information. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I see you again next week in another update.